This is an Evergreen Media Network studio production.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon. Welcome to Community Conversations. My name is Vicki Soule, and I'm the CEO of Treasure Coast Community Health. For those of you that don't know much about us, we have 8 or 9 different locations around Indian River County so that we can make it convenient and accessible for you to receive cost-efficient and high-quality health care, whether it's medical, dental, behavioral health, pharmaceuticals at discount prices, all kinds of things that are meant to keep you healthy at a very convenient schedule for yourselves and your family. So today I have the pleasure of having 2 of our latest acquisitions to our employed staff. Dr. Joe, who is the chair now of our dental department.
Dental director. Yes.
Dental director, welcome.
Thank you.
And we'll talk a little bit about your bio in just a second.
Okay.
But I also want to introduce Mike Kay because he has a name that's about this long. How do you say it?
It's Kuestersteffen.
Kuestersteffen. Good German name. I can say that. Kuestersteffen. Well, welcome, both of you.
Thank you.
Dr. Joe, tell us where you came from in terms of your dental history.
Well, I started my career in the Navy. I was a Navy dentist for 3 years, and I got out. I worked in a variety of group practice settings. The last 15 years, I was in Port St. Lucie in a large group practice and did all phases of general dentistry.
So if someone from Port St. Lucie says, Dr. Joe, I think I recognize him.
Is that the same Dr. Joe?
Yeah, it is
right.
the same Dr. Joe.
Right.
Okay, so let's clarify. They can follow you to Indian River
Absolutely.
County.
I've had people reach out.
Oh, that's wonderful. That's great. And Mike, you just recently joined us as well as one of our 2 dental managers. So give us a short bio of yourself.
Well, I originally grew up in Oklahoma, so I have just recently moved down here, but I've been in the dental field for the past 10 years as an office manager, and I worked in tribal health in Oklahoma, and then I've come here and am loving community health here at Treasure Coast.
Is it very different from tribal health?
It's very similar. You see a lot of the same things within the community.
And I would imagine for the same reasons.
Yes.
Dental is usually not the very first thing until there's an emergency on a family's spend list.
That's right.
Yeah. And unfortunately, that does cause some problems that blow up into big problems overnight. We call those emergency walk-ins, don't we?
Yes, we do.
So tell us if someone had a situation like that where they woke up one morning and they had dental pain or a swollen cheek, should they go to the emergency room?
No, they should come to us because anybody that goes to the emergency room will eventually be referred to us. So that would be their best avenue to come to any of our locations, and we can accommodate emergencies at any time, all day.
Would that be because they can't do anything except prescribe pain relief and antibiotics in the emergency room?
No, we would assess any emergency and see what the problem was and treat it accordingly. Sometimes we can do definitive treatment that day. Other times that's not appropriate. They may be too infected. An antibiotic may help control the infection so that we can treat them much more comfortably after they've taken the antibiotic.
Okay. And so if they woke up and it were a Sunday morning and they were in intense pain, going to the emergency room would alleviate that until Monday. And then
yes,
what? And then what happens?
Well, we do have an on-call line for Sunday.
Okay.
And we are working every other Saturday, so we do have a lot of that time covered. Okay. There's always urgent care or the emergency room if we're not closed, just to get started on some sort of medication, just for patient comfort.
Okay. And then, the old, I can't afford it, also should be addressed. How do you handle walk-ins in terms of, do they have to stop at their ATM or?
No, we wouldn't worry about that for an emergency patient. Later on, for the definitive treatment, we have different programs for patients, whether they have insurance or don't have insurance or have a low-paying insurance. We have our sliding fee discount program where we can assess what they would qualify for to pay for treatment.
Okay. And that's part of our support staff, correct, Mike?
It is correct. So, yeah, the front desk would take all their information, and we would see them that day and see what's happening with them. And then they have up to 10 days to go for the sliding scale appointment to see if they can get things at a discount.
Based on income and family size.
Correct.
Okay. With proof of income over the last 4 weeks, is it now?
Yeah, I think so. I think it's 4 weeks.
Okay. So that sort of explains the emergency piece. Let's talk about the non-emergencies. If an emergency person comes in, you also already have a number of scheduled patients, correct?
Yes, we see patients on a scheduled basis for routine treatment, so that the emergencies are seen the same day, but they're worked in, when they can best be accommodated between the scheduled patients.
Okay. And again, that would be something that I would expect if someone came in early and thought they could be seen right away because they had another commitment, maybe to pick up a child at midday. We would work with them through someone like Mike or Amanda, who's at some of our other centers.
Yeah, we try to do our best to accommodate them if they have prior commitments, to get them seen so they can make that appointment.
Or at least estimate when a good time to come back would be?
Yes.
Okay. Because I'm assuming that you're still seeing several emergencies a day?
Yes, especially Mondays.
I almost didn't want to ask that question.
Especially Mondays, especially our Vero location tends to be more centralized and does attract more emergency patients. Yes.
Now, when you talk about our Vero location, I don't expect as a newbie you know the address, but for those that aren't familiar with our central as opposed to our Oslo or our Fellsmere, can you give a more basic demographic like?
Well, the Vero dental location is right on State Road 60, right there in the center of town, close to downtown. And then our Oslo Road location on Oslo Road, obviously. And then the third location right now is Fellsmere. It's about a half a mile west of I-95. And we're excited about the newest, which would be Vero West, maybe half a mile east of I-95. At the intersection of State Road 60.
So you've been helping quite a bit with the planning for that new location,
I have.
Which is
it's exciting.
Yeah, it's still got the Clifton Furniture sign and logos on the awnings. But before too long, in February, we expect that we'll get final permitting authorization from the county, and we'll start doing demolition and rebuild inside. And you will have how many new chairs there? You recall? 8
dental plus the medical side. So it's going to be a pretty worthy location in terms of size.
So right now, you have a wait list for patients. I don't know if it's an official wait list, but I hear from people a lot that say, I can't get in, or I was on the phone for 2 hours on this Wednesday, and I never did get through to make an appointment. So why don't you talk to me a little bit about how West might change that, or any other changes?
There's such a need, Vicki, in Indian River County for our services that unfortunately it can be overwhelming for us. So that Vero West location is going to help greatly to alleviate that, as well as some changes that Mike and Amanda and myself have been trying to implement with the scheduling. The scheduling we inherited was such that waits were created, and we are trying to work through that to improve the flow and keep people off of hold and let them have more availability to us.
Yeah, because when people come in, just like in private practice, you create a treatment plan that you make with the patient based upon
the needs in the mouth,
the priorities
their particular
of
situation.
This one's going to fall out soon if we don't do something. Sorry.
Or this one hurts, do it first.
Okay. And then with that, there's a cost estimate.
Yes.
So that
it's a
they
treatment
can...
plan, a cost estimate is given. Yes.
Okay. And what's the goal to get the most urgent things done? Is it a month, 6 months, somewhere in between?
It's a matter of a week to 2 weeks, I would say, the most urgent thing. Obviously, the large fillings would be done first. Some patients, the periodontal might be the most urgent. Before we could even do restorative, we've got to clean things up enough to have a clean enough environment to get the fillings to actually stick to the teeth.
So periodontal is the actual cleaning of the teeth.
That's the actual cleaning, yes.
Well, that's a really good question, because we've had a lot of folks that have said, you're advising me to get a deep cleaning, and I don't think I need it. So talk to us a little bit about that.
At the comprehensive exam, a full periodontal probing is done, where we take measurements around each tooth. So that's going to determine your need for a deeper cleaning. That plus, where is the calculus? Where's the buildup? If it's below the gum, we need to get it to where it's at.
Why? I'm being devil's advocate. Why?
Because that's where the bacteria are. And the bacteria are what cause the disease. So in order to control periodontal disease, we need to control the bacteria where they reside, which is below the gum.
And does smoking impact that?
Smoking is a big factor in periodontal disease. A very high percentage of smokers have some degree of periodontal disease.
Aha. So, if you haven't thought about quitting before, or at least cutting back, there's another good reason. We're going to take a short break for a word from our sponsors, and when we come back, we'll talk about not only the West location that'll be opening, but something for our children. So, be right back. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs, including lots of slipcover styles from Universal Upholstery, Four Seasons, and Capri. We also have a gallery of Tommy Bahama and Lexington furniture designed for a relaxed approach to the finer things in life. And right now, all pictures, lamps, and accessories are half price. Sunshine Furniture, $12.95 US 1 in Vero Beach next to Planet Fitness. Visit our website at sunshinefurniturecasual.com and also visit our outlet and closeout store directly across the street.
Sunshine Furniture, the best in every way. Have a sunshine day. Sunshine Furniture, stop on in today. The sunshine day.
Hop on over to the biggest frog leg festival in the world, the Fellsmere Frog Leg Festival, January 18th through the 21st. Enjoy mouth-watering frog leg and gator tail dishes, browse hundreds of booths for unique gifts, listen to great music, and enjoy fun carnival rides galore. Discover why the Fellsmere Frog Leg Festival is a January tradition. Admission and parking are free. Marine Bank presents the Fellsmere Frog Leg Festival. It gets hoppin' January 18th through the 21st. Details at froglegfestival.com.
And welcome back to Community Conversations. My name is Vicki Soule, and we just had a very interesting sidebar conversation here during the break about teeth cleaning, because I'm here with Dr. Joe and with Mike Kay. Mike is our new dental manager, one half of our new team. Amanda was very busy and couldn't join us, but we'll have her in another time. And Dr. Joe, who is our new dental director here. And as he pointed out before the break, he is no stranger to Florida. He practiced in Port St. Lucie for 14 years prior to coming here, as well as a whole variety of things before that, starting with your engagement in the Navy.
Right.
So did you always want to be a dentist? Was joining the Navy and becoming a dentist sort of your early life plan?
I wanted to be a dentist. The naval thing was kind of a natural progression. I had colleagues that did it, and I checked it out, and being a patriotic person, it worked for me. It did.
Probably helped with your tuition too, didn't it?
No, it didn't.
Oh.
It didn't, but I still enjoyed my time in the Navy, and I look back on it fondly, and
Well, that's really
I'm proud
good
to be a
hear.
veteran.
Well, thank you for your service.
Thank you.
There's a lot of young people that are very unsure about that, and certainly their parents, unless they have a generational history of being in the military in the
Right.
United States, are also equally uncertain about that as a career choice for their children.
Right.
So I appreciate you saying that.
Yeah.
So before the break, we were talking about emergencies and people getting in for dental care and how important cleanings are. And I kind of poked at Dr. Joe a little bit in terms of an explanation about why a deep cleaning is sometimes very appropriate. You know, none of us think that we need to have that, but there's a very good reason for it.
Well, the very good reason is not only to clean the teeth, but it's the relationship to the gums and the health of the gums systemically to the rest of the body. The germs that are under your gums invariably get into your bloodstream and do have an effect on your heart, your kidneys, and other organs, you know, in your body. So the cleaner and healthier we can keep the gums, we can actually make the person healthier systemically.
I think back to comments that I'd heard over the years in healthcare about an individual or two that had an infection in the pericardium sac, the sac that holds the heart, and how,
Right.
you know, and I always wonder, how did they get an infection in the center of that sac that's, you know, around the heart?
Right.
That might be one of those
Right.
answers.
Those bacteria that are under the gum do gain access to the bloodstream and travel throughout the body and can land around the heart, for sure.
Not to scare everybody,
Right,
but
right,
it is
right.
really important.
So the cleaner you can keep your gums and your mouth, the healthier you can make your body.
I think too
least-
about pregnant women who have it's a twofer for 9 months.
Right. Pregnant women, that's a different issue. There's pregnancy gingivitis because of hormonal changes. The gums become much more sensitive to the bacteria and to the calculus buildup that we have. So we want to keep pregnant women's teeth as clean as possible throughout the pregnancy.
Well, when you talk about gingivitis, I think about a little bit of pain in the gums, maybe a little bit of bleeding. And when that
puffy.
happens, I don't want to brush my teeth in general.
Right. Once we remove the buildup, then that discomfort and bleeding and puffiness go away.
Okay.
Then you're going to want to brush your teeth.
Okay. Got to show that light at the end of the tunnel there. So what services are you all providing these days?
Well, we do basic general dentistry. We are providing exams, both emergency exams, comprehensive exams. We do fillings. We take out non-restorable teeth when needed, sealants on children.
Very important.
And then all phases of periodontal, whether it's a prophylaxis, which is a regular cleaning, a debridement, or scaling and root planing, which would be to treat periodontal disease.
Now, when you say debridement, I think of skin being rubbed off. How does that apply in dentistry?
A debridement might be for somebody who hasn't had their teeth cleaned in quite a while. There's a lot of buildup, but not necessarily progressed to full-blown periodontal disease.
Okay.
To where a debridement might remove it, and then we can gain access to the pockets to probe and make a better assessment to see where they stand periodontally.
Wow. That's an awesome answer. Thank you. I think I got it. So if someone has not been to the dentist recently, I know within our own family, we have some of our kids have got teeth that are like rocks. I take them in and they're like, no cavities, no cavities, no cavities. And I have another one that, he's a frequent flyer. He's in there every month, and he brushes and does all of those things. So I know everyone's not the same. But is there a recommended schedule, not just for cleaning, but also for taking a look? If you haven't been in for a while, a comprehensive exam, is that like every year, every 2 years?
Well, a comprehensive exam typically is every 3 years or so, where we do a full series of x-rays and do a much more comprehensive look. Between comprehensive exams, we do more what's called a periodic exam or an annual exam, which is generally done on an annual basis. And less x-rays are taken. I know people hate those x-rays.
Well, they're different now, though. Not only, I'm a dinosaur, so, we didn't have a panoramic view. We had hold this, hold this,
right.
hold this, hold that. Some of that has changed now.
It's changed, and it's certainly with digital radiography, much less radiation as well.
And that's a good thing because, again, I tend to think about our smallest children, and there are still a lot of parents I hear from that say, it's just a baby tooth. Don't worry about if it's got a cavity or if it's leaning or it's not coming in. So what's the norm for parents once kids get in school, that 4 to 5 year old age up to late teens while they're still in your house?
Yeah, we certainly want to see the 4 to 5 year olds. We want to head off any decay before it starts. We want to go over oral hygiene. We want to get the child used to the dentist so that they become lifelong dental patients.
Okay. We had one not that long ago who sat in the chair, and I was just making small talk with him, and a handsome young man. And I said, so where have you been before? And he said, nowhere. And I was like, okay, let me phrase that question differently. I said, have you seen a dentist in this area before? He said, I've never seen a dentist. But his teeth were hard as rocks. He had no cavities. Wow. It was just amazing. He said, this was really interesting.
Some of the little ones are brave, and some of them make the best dental patients.
That's amazing. Yes. Yeah. So fluoride can be put on by our pediatricians, but it really can also be done in a dental chair.
Yes, it can be done usually at the time of the prophylaxis, because you want to put the fluoride on a clean tooth. So once the teeth are clean, then the fluoride is applied.
And sealants are the same way, right? You want to have a...
Sealants, you'd want to do sealants most likely at a separate appointment so that we have a good bond from the sealant to the tooth.
To the
fluoride
molar.
Can inhibit that bond.
Okay.
But sealants are great because they're just 100% preventive. And so you have a tooth that you can put a sealant on today, so you're not doing a filling next year.
Very important.
Right.
So I know, Mike, you're going to make things much easier for our patients as they call in to get an appointment, to explain what their needs are. And by the same token, after this conversation, I think our patients probably will have a better understanding. Hopefully all of the community has a better understanding of why things are important in terms of our oral health. And you're taking new patients, right?
Absolutely.
Okay. Well, I appreciate that. Is there anything that you'd like to add? How they can get a hold of you? How they would benefit from something I haven't asked about?
No, I think you covered everything. Just give us a call and we'll do our best to get you seen. And we're trying to open the schedule more to see more patients.
Hiring more dentists.
We
have
assistants.
2 new ones. Well, I shouldn't say new. 2 that were bored in retirement and have come right back.
Right. That's right.
So that's a wonderful thing.
Yes.
So we're continuing to increase our staff so we can increase our services.
And we are expanding.
Yeah, I almost forgot.
We are.
Not only the West location, but more to come. We're going to be expanding on our Oslo site. So we'll have you back to talk more about that on another day.
Great.
Okay. So thank you both for being here. And thank you all for staying with us to the end of the session here. I guess it was a session, our conversation. So have a great night, and we'll see you next week.